Welcome back to the program, Will Hild. He is the Executive Director of Consumers Research. You can find his work at consumersresearch.org. Will, welcome back.
Great to be with you again.
Oh, yeah, we have lots to discuss. So let's start off with Henry Ford Health. First off, where is Henry Ford Health and what are they up to?
Well, Henry Ford Health is, as people probably would have guessed from the name, is a hospital system that was set up by the entrepreneur himself in Detroit, Michigan area. It's been serving that community for many, many years. And I'm sure most of the care that they provided has been fantastic. But as we've been part of our series pushing back against woke medical systems, we came across Henry Ford, I'm sorry to say, for the trifecta of wokeness that we find in a lot of these places. Namely, they're engaging in green boondoggle investments, focusing on trying to hit so-called net zero targets. These are extremely costly projects that do nothing to add to patient care and only raise prices for consumers. The other thing is that they've been engaging in DEI. They say it's core to what they do. And as we all know, DEI is code word for discrimination against people based on their race and sex. It's a focus on discrimination in hiring and promotion to try and bean count, what percentage of your staff is a certain race and sex, which is per se illegal under U.S. labor law. And so we want to see that come down. And then last, but definitely not least, I saved the worst for last, actually. I'm sorry to say that they are proud about the fact that they are still engaging in what they call, what the left calls gender affirming care, what I call the mutilation of children. Which we have to put an end to that in this country. Many states have banned it. I'm sorry to say Michigan has not yet, but we're putting the focus on this hospital system and saying enough is enough. You need to cut this nonsense out.
Yeah, and by nonsense, you're talking about it's just a dramatic overgrowth. It's like it's been put on steroids, the woke mind virus that is moving through parts of our culture to include our hospital systems where they're requiring new medical students to abandon reasoning and abandon the scientific model, which is a binary reality.
That's exactly right. They basically are telling people that are supposed to be evidence-based. My wife's a physician. That was the code word. That was the big buzzword, I should say, when she was in school. Everything has to be evidence-based, evidence-based. I can't think of anything less evidence-based than the idea that there are more two sexes, or that through surgery and injecting oneself with the same chemicals, or injecting someone with the same chemicals that they use to castrate pedophiles, that you're going to change their sex. That is not evidence-based. In fact, every bit of evidence we have, from the Tavistock investigation that was done in the UK to a whole plethora of studies done here in the United States, suggests that is the opposite of evidence-based, and yet that's what they're still pushing, because it's about ideology. Like you said, it's the woke mind virus.
So let's go into some more detail here. I think it's killing us, right? We feel like we're being pushed beyond all reason, but you have something. It's FordHealthExposed.com. Henry Ford Exposed. They put politics over patients, and they have media reporting that shows that Ford Health admitted they're currently offering harmful, irreversible transgender treatment for kids, which I hope they're sued for. Diversity, equity, inclusion. They believe in that and that it's woven into the fabric of everything we do. That's nonsense. That's like saying we believe that fecal matter is woven into everything that we do. That's not true. And then climate activism. Henry Ford Health is spending millions of dollars to create Central Energy Hub to achieve net zero emissions, which is impossible because without CO2, the entire planet would die. But they're pushing that too.
That's exactly right. And these directives, to hit net zero that we've seen from a lot of the hospitals, it's ridiculous on its face just because of the electricity uses necessary to run a hospital. But think of all the products that are literally made with petroleum in a hospital that are necessary to run a modern medical facility. This isn't the 1800s. We don't use glass bottles and jars anymore. We use plastics because they can be sealed and antibacterial, right? Imagine not being able to use tubing or plastic containers for all of your. Do you really want the doctor pulling a scalpel off of a that hasn't been sealed in a plastic container? All that stuff is made with petroleum. The entire concept of net zero is just truly absurd.
It's unbelievable. Of course, we already had our run-in with the paper straws, right? Remember when we all, the paper straws, the plastic straws are killing the planet. And then the paper straws started melting in our mouths. And then we found out that they're toxic and cancer causing. And then everybody was just like quietly back to the plastic straws. I mean, it happened so quick. It was delicious, actually.
Yeah, I'm extremely, call me a paranoid about that, but I still think that there was something fishy about how that all happened. You know, the whole thing was supposedly based on some ninth grader's science experiment where he miscalculated, I should say, the amount of plastic waste coming from straws. And then suddenly you have the largest corporations in America overnight all changing their products. I would imagine a lot of ninth graders are doing a lot of science projects every day. That doesn't cause most of corporate America to radically reduce the quality of one of their products in a way that ticks pretty much everyone off, as you noted. So I don't know what it is. I don't even have a theory, to tell you the truth. But somebody has to have been behind that. I don't know if Big Paper Straw launched a conspiracy there, but that kind of stuff I can just tell you, given the space that I'm in and what the trends that we see, that kind of stuff just doesn't happen organically overnight like that did. Somebody was behind that. Someone had money to be made on that. And that's one of the real frustrating things that we have to push back on, is they will always use a front of, oh, this is good for you. Well, this thing that we've decided overnight, whether it's to lock you in your house during COVID or to force you to take an experimental vaccine, or now you have to use a paper straw, they'll always either say it's good for you or good for the environment. But you should be suspicious anytime, thousands of major institutions from across the country all decide on the same thing at the same time. I can tell you that does not happen organically. Somebody was behind that.
Right. We can contrast that with new products that roll out, right? When new products roll out and they go viral, you still don't have an instant adoption by everyone in the country at the same time. A lot of times it's regional, right? They'll roll a product out on the coast, or they'll roll it out in the region where it is most likely to be very successful, like if it's a product they think will do well in the South. And then it becomes almost a demand issue where people who want it will either go get it from wherever it's currently available. They try to order it into their area, and then there's a shortage, and then you see manufacturing spun up to increase the amount of the product available because the demand is very, very high. It still takes time. But an instant rollout where everybody has paper straws at the same time, right? How'd that happen? How did they get their orders together all at the same time? How were there enough paper straws available for all of the restaurants and all, except the smaller individually owned, but all the franchise restaurants had them. And certain restaurants, like they didn't have paper straws at Chick-fil-A, but they had them at all of the other restaurants. You see what I'm saying? Like the other fast food joints had them. How was that done? It's such a good point you're making.
That is a great point that you are making, because think about all the great products, like the one I'm using right now to talk to you, cell phones. How much better is a cell phone than a paper straw? That's like an infinite difference. And people didn't adopt cell phones. I mean, the utility is obvious, right? But people did not adopt cell phones overnight. They didn't adopt the internet overnight. How is it that this incredibly crappy product that is completely inferior to what we were already using got rolled out overnight, like you said? Where was the production? Who was making all these paper straws that they were ready to buy them all of a sudden? Because why would you have been pumping out these things beforehand when no one wanted them because they suck? So that is such a good point. Just the supply itself proves that someone knew it was coming or someone was behind it, because you wouldn't have had enough paper straws. And I think it's funny you mentioned Chick-fil-A, because they are kind of the exception that proves the rule, right? They've historically been, not always, as courageous as I'd like, but they've historically been one of the big ones to push back against whatever the, quote unquote, current thing of the day is. And so the fact that they didn't switch says a lot about what was going on, that they didn't feel the need to jump in on whatever this new social trend was, because clearly it wasn't customer demand. Chick-fil-A is one of the best companies at responding to customer demand in the entire country, if not the entire world. What they weren't responding to is some, psyop to get us all to use these inferior straws that, as you said, cause cancer. Right.
And then, okay, that's the other part, because this is very, you know what we need on, John Stossel should do a deep dive on this. He does those 5-minute videos where he does all this research and then he calls it all down into 5 minutes or less. And he tells you exactly why, like, why did we all use paper straws for about 6 months and then all of a sudden they're cancer causing, we're not going to use them anymore? Who did the research and found out they cause cancer? Or is it that they had carcinogenic in them. Who figured that out? Did someone's straw melt and they took it to their lab because they're a researcher and they analyzed what it was made of and said, hey, this is made of a glue that's a carcinogen? Like, exactly how did it happen? And I love the timeline from the moment some green energy nut job said, plastic straws are killing us, we need the paper ones. We don't use paper bags anymore. We don't use plastic bags anymore. We use paper. So we should be able to use paper straws. And then someone else said, well, they'll never stand up because paper melts in liquid. And they're like, no, they have technology for that. Then all of a sudden they had 1 billion paper straws ready for everybody to use. Who paid for it?
That is a great question, and not one that unfortunately I can answer. But if you're interested, there is a guy on Twitter, or I guess X now, called Disgraced Propagandist. His real name is Isaac Simpson, I believe. And he is exactly the kind of guy, if you're, nodding over your booker right now, you guys should look him up, because he's done some interviews where he talks about the ways in which these PR companies, if you've ever read an article where it says, thousands of people are doing the ice bucket challenge or whatever, okay? That reporter didn't wake up and say, I'm going to go just see what's happening and then write about it. A press release was sent to their inbox and said, we'd like you to write about this thing called the ice bucket. Say that thousands of people are doing it, because it creates the impression and causes it to go viral. It wasn't going viral, but it caused it to go viral. Some firm like that was behind this paper straw thing. Somebody paid somebody to get this thing going. And they're like, oh, we'll find some ninth grader, we'll have him do a project, and we'll get a human interest story. Well, really, somebody needed to offload a bunch of these stupid paper straws, and we all had to suffer for it. So even Kamala Harris admitted during the campaign that they're awful, which is that was pretty stunning, given how much they were pushed on us for her to admit that. But, and that's really what this woke stuff is. The gender, to steer back to Fort Health, the gender ideology stuff, it's just a meme, guys. It's not real. No scientist actually believes any of this stuff, but it's being forced down our throats by a bunch of PR firms and ideologues.
Whenever we see someone who should believe in the hype but says they don't, like a paid and bought and paid for shill like Kamala Harris, and she says, oh yeah, but the paper straw sucked, she didn't get any of the paper straw marketing money. She wasn't an influencer. She wasn't a part of that stream of income. So she didn't have anything to lose by telling the truth about it. That's the real place for us to look, whether it's gender ideology, on any of these things. The person who's telling you that this is the best new thing, this is a good idea, this is viral, this is important, it's scientific, whatever they're telling you, you have to pause for just a second before you hit buy or hit, because it happens so fast on Amazon, you almost don't even know you're buying anything. But before you take what they're saying as the gospel, you have to stop and say, okay, but why would this person be peddling the vaccine to me? Or why would this person be peddling gender-affirming care to me? Is this person a researcher, a scientist, someone who has your data, books, white papers? Is this person an influencer who is getting 3,000 or 30,000? I've heard some tales from people who have millions of followers that, these payments can be a single 30-second endorsement that's done naturally within your YouTube stream can pay $30,000 if you have a few million followers. So that's a one-time payment of $30,000 for 30 seconds of your time. I'm just, come on. We just take what people are telling us at face value, but the paper straw, the gender affirming care, all this stuff, we've got to start questioning.
100%. And I don't want to make anyone a paranoid, but you really do have to, there's a Latin phrase, caveat emptor. It means buyer beware. And that really is the key here. People need to be thinking. You are bombarded constantly with propaganda of all kinds. And just because someone says it doesn't mean they authentically came to that position. Like you said, people pay thousands, if not tens of thousands, if not sometimes hundreds of thousands of dollars just to have someone mention something in a video or something that could be about something completely different. So absolutely, you don't just think because something's supposed to be popular that it's real.
And so we're talking about Henry Ford Health. I just want to add a couple more things that I want to make sure people understand what you're talking about. Henry Ford Health is pushing irreversible sex changes on kids. They are almost like a factory in their efficiency at getting these things done. And the irreversible procedures, we have to remember, that's a future, it's a young person, it's an adult, young adult, who suddenly isn't gender confused anymore. they've outgrown it, but their body has been permanently changed. I don't even know if we can fathom what that must feel like for someone. We can imagine, we can try to empathize, we can mentally go through the steps of, okay, this is what this person, was it subjected to, this is what they were suffering from. But then the switch that happens when they're no longer suffering from gender dysmorphia, if they're walked through it by parents who love and care for them and are staunchly opposed to permanent changes, then as an adult, they're free to make a decision about what they'd like to do with their body. Get married and have kids, or never have children. Anything that's in between those two things, they can still do, unless they've been to Henry Ford and had their, parts permanently adjusted. That's what's at stake here.
100%. And think about that sense of betrayal that a young person would have. Maybe this was done to them when they were in their early preteens, okay, when they're supposed to be protected, not just by their parents, but by society. And they would know that they were at Henry Ford Health, and just down the hall, people were coming in to get, oncology appointments or radiology appointments or to have a broken bone set or deliver a baby. And no one stood up and said, you are not going to do Dr. Mingala-style experimentation, this insane nonsense on kids based on scientific theories that are, to call them scientific, this is a gross overstatement. There's nothing scientific about this. It's the opposite of scientific, right? As a society, we have a duty to protect the weakest among us, and there's no one more vulnerable than children. And so that's part of the reason why I do think this is a consumer issue. When you go into Henry Ford Health and you're there for some other reason, I assume most consumers do not want to find out that down the hall they were doing this to children. And that's why we're raising an alarm and trying to highlight this issue. Michigan, unfortunately, has a governor that I don't think is going to do anything about this, but their legislature does and can do something about this. And so we recommend that people who are outraged by this to contact their representative or their state senator, state rep in Michigan. And also, the Trump administration has said that they're going to be investigating this. And so that's the other reason we're highlighting this, is for anyone inside the administration or close to the administration who's listening. This is something that really needs, children are being victimized, I would assume daily, as they go into these so-called gender clinics. We're hoping that both at the state and the federal level, we'll see something done about this to protect these kids.
I love it. This is the battle. And so whatever way we have to go about if it's going legal, if it's going legislatively, if it's going through Congress, these are all legitimate methods. We're not talking about burning, Tesla dealerships to the ground. We're talking about conversations, debate, some disagreement perhaps, and things going through the legislative process, which is the system that the founders left to us. This is our heritage, to be able to disagree and then to work really, really, really hard to change the minds of other people. This is the way it's supposed to be done. So I think that's a really excellent point and something really good for us. So one last thing here about Henry Ford Health. You also have another article about something that they deleted. What's going on here?
Well, that's something we've seen across the board when we've gone after these health clinics, whether it's been Cleveland Clinic that literally as they send it, they cease and desist. I'm really reading through the cease and desist where they call me a liar and say none of the things I'm saying about them are true. They were deleting all the websites from the gender clinic and the LGBTQ center, even ones they'd opened in other states, like in Florida. They were deleting all the web pages. Vanderbilt, they must have got word that we were looking into them because suddenly they put all their DEI pages behind not a paywall, but a password-protected website so that we couldn't access them. We'd already archived it. It was too late for them. But we started whatisbandyhiding.com to highlight for the Tennessee legislature and for others, that they're clearly still continuing this DEI. They just don't want anyone to know about it. And that's something we've seen across the board. I have to go back and look at what the exact website it was that Ford Health deleted. But pretty much any time we have highlighted what's going on at these hospitals, they will deny it and at the same time try to delete all the evidence. It's pretty sad that these people that we supposedly trust take care of our health, we would think, just like a lawyer, you'd want your doctor to be like the most honest person, right? And yet these are people that when confronted with the truth, they go run and try to hide everything and delete the evidence. And it's also just kind of foolish because it's like the internet is forever. Do they think we put out a whole press hit and all this, and I'm doing interviews and we didn't archive it all? Of course, we still have copies. So it's not just dishonest, it's also like, how dumb are you? I don't know that I want a doctor who thinks that he can delete things from the internet and then they actually go away. That's pretty stupid.
Oh my gosh. I love the way you put that. You know what it reminds me of is the government employees who deleted a terabyte of data only to have Elon Musk casually, as if he were talking about, what kind of clouds are in the sky during the day. He was like, yeah. And then some people tried to delete 1 terabyte of financial data from the government's computers, but of course, we saw them doing it, and, it's not ever really deleted, so we just recovered the information instantly, and it's still there. And then he moved on to the next thing. It's so funny. And that's you sound just like him. You're like, why would we do press releases and do media hits if we hadn't already created an archive of all said data so we could refer to it in our writings and speaking engagements?
Well, and just for anybody listening who we end up hitting at some point and who's tempted to do this, not only do we archive it, we use a third-party service that puts a hash in the file that makes it admissible in court. If it was ever to be needed to be used on evidence, we can prove without a shadow of a doubt that was the web page that was up at that time. So it's not just that we have an archive copy. If there's ever litigation, we will be bringing it in as evidence. So for anyone thinking stupidly that that's a good way to get rid of something, it's not. And I'll just say about the Elon thing, this is a complete side note, but I couldn't believe the left-wing press trying to go after these, whiz kids who he's got. First of all, we have a whole, that's the history of innovation in the whole world, has been young 20-somethings discovering things that people 40 years older than them had never thought of. So that's just kind of a ridiculous thing to begin with. But one of the kids that they attacked had used radiography and AI and cryptography to figure out how to read a bunch of scrolls that had been covered in lava at Pompeii that we can't even open, much less read. And they're just like these little charred hunks. And he took the scans and figured out how to read them. And we've actually been able to read because of this 20-some-year-old kid. And that's who the press is saying is an idiot compared to a bunch of do-nothing, know-nothing bureaucrats whose lunch they're eating and getting rid of all the waste and abuse. So I just thought that was kind of funny. You brought up the fact that he was so nonchalant about it because he has literal geniuses working for him. And so it's just crazy that they would try to make fun of these kids.
I love that story. That's one of the side, not as good, is I read a lot of stuff every day. And sometimes even over the weekend, I have to remember to save things so I can share it. You just shared something I'd intended on sharing here on the show, and it must have gotten lost in all of, my link held. Things just get just posted and they don't get discussed on the show. But I have to tell you, Will, that was one of the most impressive things to me, was looking at some of the backgrounds on these young people. They're 20, but have already, launched successful companies. They're geniuses. They've gotten done with high school when they're 15, 16 years old. They launched their first company and sold it before they're 20 years old. And that was the ad. I don't know if you saw it, Will. You probably did. Back when Doge was still something that was being talked about on the campaign trail, Elon Musk would occasionally post. He'd say, can you solve this puzzle? And he'd put up a math problem that looked deceptively simple, but the longer you sit there and stare at it, the more you think, I have no idea how to figure this out. He was using that as an entry, if you can solve this, send me the answer. They send him the correct answer, and then he kind of ushers them into his gauntlet process to see if they really are geniuses. And who would know? He would, because I don't care what the others say. He's a rocket scientist, multi-billionaire, philanthropist, playboy, genius. He's the literal Tony Stark, and he's an actual genius. I just don't understand why people are discounting that he would pull together individuals who could do things that have never been done before, like what you described with that scroll. And some people don't care about that stuff, but that's where the innovation comes from. It's finding I'm trying to solve a problem for the scroll, and that ends up being something that it might actually be a groundbreaking technology for discovering disease in cells that they can't see. We have a lot of radiographic equipment, lots of different kinds of scans that you can have, but they're always looking for better ways to detect things early. That could be a part of it. I mean, that's something that seems like it would have crossover benefits. So we should be grateful that he's discovering these geniuses and bringing them to the fore, and that they're working on government of all things.
Absolutely. And if you'll humor me on a quick detour that will seem unrelated, but it's not. huge news today coming out of the Trump administration via executive order. I don't know if you saw this, but he just earlier today got rid of the LBJ era executive order that put something called disparate impact into place. And disparate impact, the theory of disparate impact is that you can sue over something being discriminatory, even if the thing itself, meaning like a rule that, say, firemen have to be able to carry 200 pounds, which seems reasonable, okay?
Yeah.
If the net effect, okay, is that it has a disparate impact on some populations. So, for example, that rule would make it harder for women to be firemen, right? Because they have, on average, lower muscle mass and can't carry 200 pounds, at least as many of them, right? Half the female, you're not going to end up with 50% firemen or firewomen,
no way,
if that's the rule.
Maybe 10%, right?
Yeah, maybe 10. And that is even, I mean, the stats I've seen is crazy. But in any case, disparate impact has been the biggest reasons why everything has been being dumbed down over time. Standards being decreased in the military, in government, even the civil service exam that, was put in place to make sure we got the best people that we could get. I think it has like a 95% passage rate now, which is not what it was intended to do. It was supposed to weed out a good portion of people. But because of disparate impact and the litigation around it, all of these requirements that would normally be there to make sure we got quality people, both in government and in private sector, have been being dumbed down. And so the genius is, like the guy that, was able to decode these scrolls, the genius is they've been getting weeded out so that we could basically have economy-wide, society-wide DEI because of disparate impact. So today was a huge victory, not just in the fight against Ford Health, but also in the fight against DEI and the fight against low standards and low outcomes and bad outcomes. We want the best of the best. And I'm hopeful that more kids like who we've been talking about will now be able to get into these areas because they won't be up against institutions that are making decisions almost exclusively on worrying about getting sued rather than being able to do great and incredible things like Elon has been able to do. So today was a huge victory thanks to the Trump administration.
And I'll just piggyback on that. I love it, Will Hild, when you go wide, you're like, hey, I got, it seems like it's not related, but it's related. We're all ears for that stuff because it kind of gives you something to think about right before you go to bed to give a problem to your brain to work on overnight. It's, disparate impact being repealed. It's a little bit of it's like a cortisol boost because you're literally, you're not worried about this problem that has been going on for so long that has made things not make sense. Because the DEI policies actually make our world, which trends towards things making sense, DEI makes things not make sense. And the reason why I'm happy about it, because I know there's someone who's about to email me and say, well, without disparate impact, you wouldn't have a job. Actually, what I won't have is people assuming that my child who is doing something extraordinary is only at the school she's at or only doing what she's doing because of DEI or because the standards have been dumbed down. Then she'll actually get credit for what she's doing. Then people will think when they see a person of color or they see a woman and they're doing that job, they'll think, oh, okay, she belongs there. Oh, she earned it. The standards are the same for everyone. So that's a person who, she must be in the top, whatever the standard is, top 10%, top 25%, whatever it is. It will take away the stigma that currently follows minorities around, that when you see us, we don't really belong there. We are the recipients of some kind of DEI or other policy that's making it possible for us to be there, not our effort, our hard work, our energy, our merit, our brain power. I think this is a fantastic development, and anyone who emails me to say differently, I'm just going to read it, and then I'm not responding to you because I really don't care when you're wrong. I care when people are right, but I mainly care to put out the right information. But that's a fantastic development for all of us, every single American.
That is such a great point, Stacy. I try to bring this up whenever I get a chance when it comes to DEI. Especially I have a wife who's an OBGYN, so I saw what we were dating when she was in med school, so I saw what doctors went through. Never in my life have I walked into an exam room when I was seeing a doctor and even noted with really real, sense of it having an impact on my healthcare, what the color of the skin of the doctor was, because I've seen what they've been through. They run them through the gauntlet, okay? But what we've seen with DEI at med schools over the past 5 to 10 years is going to start reinstituting racial stereotypes into people's thoughts about their healthcare. And the reason for that isn't because blacks or Hispanics or whatever can't be good doctors. I just got treated by one this week that was fantastic, who was black, okay? The reason is, I don't care what the criteria is. Say it's left-handedness. If we started saying that left-handed people didn't have to hit the same criteria, they didn't have to take the MCAT, or they didn't have to get the same MCAT scores, or they didn't have to pass the same tests, it doesn't matter. Guess what would start happening? You'd walk into an exam room, and that doctor picks up something with his left hand. You can be turning around, walking right back out. And that's what's going to happen. All of this DEI stuff that's supposed to make us less racist and more together. Well, I should say supposed to. That's not what it's supposed to do. That's what they advertise it as supposed to be about. But that's what it's really about, is maintaining the grift of the mediocre against the excellent. The people who operate these DEI departments that are desperate to keep their grift going are the most mediocre losers you've ever met in your life. And the reason they're so desperate is because they couldn't do anything good and useful in society. So they have to keep this grift going. That's why they're so worried about this. But it's not just, white people or Asian people or whatever who are being discriminated against that are going to get hurt by this. To your point, it's going to be the supposed beneficiaries of DEI, right, who are themselves going to get hurt because it's going to reinstitute racial stereotypes, and people are not going to be entirely irrational for worrying about that. Just like I said, it's not about race. It's about any criteria you picked, and you lower the standards for that criteria person. People are going to think, well, I don't know if that person actually can cut the mustard or not, okay? So if you do that to blacks and Hispanics, you're going to undermine, to your point, your children's ability to earn things and have people respect them for what they've earned, because they won't know. People won't know whether they got them right. So you're exactly right. The best thing that can happen for your children is for DEI to go away, so that the things that they do, that they earn rightly, accrue to them and accrue to their reputation as it should be.
Yep. And this is, so it's never going to be perfect. There's always going to be a situation in which, we're like, this is an injustice. But that's what we have our system of government for, is to work together to eliminate injustices. And on the other side of that, we want people to be seen in their positions as, this is just someone who is competent, because I have the same thing. When I walk in, I'm usually, the only time I'm judging the person's characteristics is if it's an OBGYN, to be quite frank. If it's an OBGYN, I'm hoping it's a woman. But other than that, I don't care if it's a man or a woman. I usually just try to see if the doctor and I can create rapport over whatever the issue is that I'm coming in for. And usually, I'm successful in that. And, that's because doctors want to help you. So they want to create a rapport as well. I don't go in and say, oh my gosh, I'm black. I need a black doctor. I'm a black woman. I need a black woman doctor. Like, I do not do that. And I don't know anybody who does. Maybe there are people out there who do, but well, there's always going to be a minority of people who are doing stupid things. So we can never have to worry about that being our issue as long as we aren't promoting DEI. So if it's not in the government, a lot of private sector companies will follow suit. And that is such great news.
That's exactly right. And there's always going to be weirdos in society. You can't restructure all of normal person society because there's a few oddballs who insist on doing something. And you don't even know why they're doing it. Sometimes people have, the paranoid schizophrenics and stuff like that. I mean, I used to have a neighbor that was paranoid schizophrenic. They said all kinds of stuff, but it was a medical condition. It had nothing to do with the actual belief. So, and to your point, I understand. I'm actually shocked that they're already male obese, because I can't fathom why a woman wouldn't want a female. But that's an area where we need to be easier on each other, right? Because there are reasons why people want different things that don't necessarily mean they hate a group of people. I don't get the sense that you hate men, right? But the fact that you would want a female OBGYN makes perfect sense. But that doesn't mean that. Again, that's customer driven. That's the consumer deciding what they want. That's not a top-down system of DEI, quote-unquote, professionals, or losers, as I would call them, DEI mediocres, forcing that on everybody, and that's the difference.
Yep, and there are enough women who don't care, so that, male OBGYNs never have, there's actually a shortage of OBGYNs, so most women are just like, oh my gosh, is this someone who can give me an appointment within 90 days, and I don't have to wait 6 months to get in? I'll take whoever they'll give me. But, if you're having a baby, sometimes it's nice to have a woman to help you through that 9 months, because it's so life-altering. And that's when you're saying, oh, I'd kind of like to use the female OBGYN in the practice. And they never, ever deny requests like that because they know it's not gender-based because of any kind of hatred. But it's such a good thing. I'm glad you're a young person, and your wife, she's an OBGYN. That gives me hope every time I hear about young people who are doing great things, especially you guys are kind of in diverse fields, the two of you. She's in medicine and you're in the political sciences. It's an interesting juxtaposition, but I love it, and I think it's excellent. And it's one of the reasons why we love having you on, because you can bring those extra perspectives in and give us two separate awesome developments. And you taught us about Henry Ford Health, which I will be frank, I wasn't actually aware of it before this. So we'll continue to watch and keep our eyes on your website, which is consumersresearch.org. Will, thank you so much for coming on.
Absolutely. Always great to be with you, Stacy. Love coming on, and look forward to coming back soon.
All right. We'll talk to you again soon, Will. And everybody go to consumersresearch.org. And